I remember my mom saying to me, I just read about something called AIDS. Be careful when you drink out of the water fountain. Nobody knew what it was about.
It was terrifying.
I was 18 years old and someone said there's this thing called gay cancer.
Where I grew up, it was like, if you were gay, you're going to die.
When I was 10 years old, I said to myself, well, this is what I'm going to grow up to be. I'm just going to grow up and die.
Beginning in 1981, physicians, including myself, especially in California and New York City, began to see young people with an amazing new disease, largely in gay men.
There was this assumption that if you were gay, you were going to get HIV, and you were going to get AIDS, and you were going to die, and that's just what it meant to be gay at that point.
I had my first HIV clinic in San Francisco in 1985. All of my friends came to see me because they thought that'd be really cool to have their friend as their doctor, and I diagnosed them all with HIV, and they all died. And so it was a very dark time.
I had a cousin pass away from AIDS when I was a kid.
My cousin succumbed to the virus. I had a great uncle that passed away from HIV in the 80s.
I had an older brother, 7 years since he's passed away. He was diagnosed with HIV. With him not being able to find the support or the help that he needs, the virus ended up transitioning over to AIDS.
The reason why we do this work is because we don't want more people like that we lose to this deadly virus.
From like 1979, really through the early 90s, there were no effective treatments.
We lost 10,000 people in West Hollywood. 10,000. And West Hollywood has about 35,000 occupants. So you can imagine how devastating that was to the population.
Some of the things that have impacted my life is people that have lived before me or the same time as I did and have died of HIV. They could still be here if there was such a stigma in the community about HIV.
I think people also felt like at that point their life was over. No one wanted to date anyone who was HIV positive. No one, people were afraid of you if you were HIV positive. Even healthcare workers.
When AZT came along, it was effective, but it was really crappy. And in terms of tolerability and side effects, patients who were on it really had a hard time. And so the 90s were kind of full of horror stories about the number of pills that people living with HIV had to take and the side effects that they had to live with.
I used to deal with patients that would take handfuls every day, several times a day, set the timer, and I would fill pill boxes for these patients.
3 pills every 6 hours, and then 2 of these pills every 4 hours. They don't sync up, so like you're taking pills like every 2 hours. It's just a complete nightmare, from a personal perspective to deal with that.
Many patients, it almost became a choice, like what is worse? Like just letting this disease take its natural progression or trying to extend my life and having a lower quality of life?
People were still dying because it took years for everybody to get on the medicine, stay with the regimens because they were very difficult, multiple pills, lots of side effects. And so a lot of people floundered with their medication and didn't do as well.
And I remember they would come to the pharmacy in tears, just newly diagnosed. And I would sit with them and talk to them and explain. I'm going to get a little emotional because it was really a hard time for so many people. Tears, just so much uncertainty.
1995, I think, really was a big turning point of where things just started becoming so much more hopeful.
We saw the death rate within years plummet from a life-threatening, very serious disease to something that is manageable and chronic.
The HIV community was seeing massive changes, with new drugs coming out. The leaders of the movement, both research and sociologically, were making such huge roadways in terms of acceptance and treatments.
It's been interesting to have navigated all the different phases of the HIV epidemic, from the beginning when we didn't have any medications and it was universally fatal, to 1996 where we first actually saw a combination of 3 drugs would give us sustained viral suppression, and we thought maybe this is an answer. We didn't know though. People still weren't sure they were going to make it.
We still had people in the hospital every week, but now over the years we've had new medications, easier regimens, better tolerated. People are doing fantastic. They're taking their pills instead of trying to talk them into it. They are happy to do it.
When I started working as a pharmacist, it was 22 years ago. And at that time, it was so different than it is now. As a pharmacist in the same place for so many years, I met so many people that I became so close with. And I did notice that in the beginning, we were losing people. And then as time went on, we stopped losing people. It's remarkable to be able to still be in contact on Facebook with some patients who I was the first person they spoke with after they got their diagnosis. Being a pharmacist in the HIV arena is a really unique position to be able to dispense a medication that can keep people alive.
One of the great tools we have is biomedical prevention, which is kind of a fancy word for PEP, which is a medication you take after you've been exposed to HIV. You come in, you let us know within 72 hours, the earlier the better. If you've been exposed, we're going to give you a bottle of meds, and you're going to take one of those pills every day for a month, and odds are you're not going to contract HIV. It can prevent infection even after you've been exposed. PrEP, pre-exposure prophylaxis, this is a pill you take every day. You get the prescription, you take the pill every day, and if you are exposed to HIV, the virus can't infect your body. So it prevents an infection from even starting.
Even in terms of people who don't have HIV but want to protect themselves against it, we are seeing advancements come faster and faster. We will be looking forward to injectable PrEP, where it will be not one pill every day, but a shot once a month, once every other month. And so I think in terms of where we're going in both the treatment side and the prevention side, we couldn't be in a better position 40 years into the epidemic at this point.
I see now HIV negative men having a much more open mind about HIV status.
There's not the stigma involved with HIV anymore as there was back then. It was a death sentence, and now it's like you're going to live a normal life expectancy. Count on it. Don't cash in your life policy, and you're going to keep your job because you're going to need it. That kind of thing. It makes me reflect on the past and how far we've come, and what the future is going to look like. I mean, I think HIV will be a thing of the past at some point.
I think it's a possibility. We have the tools. Whether as a society we decide that we want to put the resources behind those tools, and we want to make sure that everybody has access to those tools, that's in a way it's a much more complicated problem than biology of it.
We are in a very comfortable area at this point for those who can have access to medical care and for those who can afford to take their medications. Unfortunately, what the biggest thing that we need to work on is the social disparity.
There's no reason, like if we lived in a perfect world, there's no reason that any disease should be distributed unequally among a population, right? I think what health and health inequity does, it illuminates disparities that already exist in society.
If that is not being addressed, it's becoming a public health problem, and racism is a public health problem.
Number one, we've got to be in the communities where it's happening, and so someone living in far South LA shouldn't have to take 2 trains and 2 buses to get to the nearest HIV clinic that's going to provide them culturally competent care, both in terms of their race, ethnicity, and their sexuality. And so the more we can be in those communities and we can give them closer access, the better.
I think there's like this whole package that needs to come, but then that costs money. And if it costs money, or if you have to have insurance, or if you hear that therapy's $200 an hour, you're like, I have other things to spend that $200 on. But one thing about SoCal Club is that we offer these services for free. And the testing services, the mental health services are all included in our programming.
The most rewarding part of my job being here at Men's Health Foundation is being able to assist my patients, to be able to help them out, to be able to say, hey, you didn't have health insurance, it's okay, we're going to help you out, we're going to be able to enroll you to a program. You don't have way to pay for your medication, don't worry, we're going to work with Gilead Advancing to get your way to get your medication at no cost.
I'm really amazed and happy that the vision that Dr. Mills seen in creating a space like this in South Central came to fruition. He listened to the youth and he made sure that their words, their thoughts were put into place here in the club.
We can have the absolute best vaccine or treatments or cures, but if people aren't connected to healthcare, it's all for naught. I look for employees now that are really committed to that mission. I mean, this is really what I think the Men's Health Foundation is about. You know, our mission is to connect men at risk to care. We don't specify at risk of what. It might be at risk of HIV or STDs. It might be at risk of COVID. But I think if you could take people and connect them to comprehensive health care where they can get medical care, they can get behavioral health, they can get substance use treatment if they need it, I think that can change people's lives.